Hi, I'm Mike Tegman, and I'm here to talk with you today about some kind of grassroots perspectives and focus on healthcare reform and community health improvement. I'm an old paramedic. I worked the streets as a paramedic for about 15 years, and then evolved into working with healthcare organizations, primarily EMS organizations, all over the world. I've worked in 48 of the 50 states, most of the Canadian provinces, Israel, Palestine, Australia, Tasmania, all over Europe, really helping EMS organizations, primarily emergency medical service organizations, improve the care and service that they provide to their communities. And what I'm really interested in doing with this series here on YouTube is to talk with you about ways that whether you're a regular person in the community or whether you're a healthcare provider, or EMT, paramedic, nurse, LVN, whatever you happen to be in your community, kinds of things that you can do that are easy, low cost, and have the potential to make dramatic improvements in the health status of you, your friends, your neighbors, and the people that you work with. That's the primary objective. And one of my big inspirations for this whole conversation, something I've been thinking about for about 6 or 7 years now, was a presentation I heard at the Institute for Healthcare Improvement's National Forum a couple years ago. This was done by a guy named John Kitzenbach, who is the two-term governor of the state of Oregon. He also happens to be an emergency medicine physician. And he did the best job of anybody I've ever heard kind of frame the issues around healthcare reform. And he basically said, and this year, I think the talk was done in 2008 in December, so it was coming into 2009. Said in 2009, 9% of federal tax dollars will go for healthcare, for Medicare, for Medicaid, NIH, those kinds of things. Said at the current rate of healthcare inflation, by the year 2025, it would be up to 32% of federal tax dollars in the United States focused on healthcare. That translates to $62 trillion. And he said to the audience, it was kind of an overwhelming number to me. He said, I'm not sure if you can get your head around what a trillion translates to. So he said, I broke it down for you in seconds. 1,000,000 seconds ago, it was the beginning of last week. He said, 1,000,000,000 seconds ago, Richard Nixon was just leaving the White House. 1,000,000,000,000 seconds ago, it was 30,000 BC. Trillion is a huge number. And when it comes to $62 trillion, he followed that by some of the research that the Institute for Healthcare Improvement has been doing over the years. He says what we know about healthcare is that half of the money that is spent, quote unquote, on healthcare is actually waste. It provides no direct benefit for people who are sick or hurt or are trying to prevent healthcare consequences down the line in their life. It provides no benefit for them. So trillions of dollars, enough money to leave Iraq a healthy, wealthy country, to bail out Wall Street, bail out the automotive industry, bail out anybody else that needs bailing out, and still have enough money left over to cure cancer. Gets wasted by the healthcare system on a regular basis. But that's not what we're going to talk about today. The next thing he said is that of the money that is spent on care for people who are in need, 70% of the money that's spent is spent for people who've got chronic disease. Chronic disease like asthma, like diabetes, like heart disease, like various forms of cancer. There are chronic diseases that take up the majority of the healthcare dollars. And he said, and this has certainly been my experience as a paramedic and working with paramedic systems, that the majority of people with chronic disease don't interact with the healthcare system until they haven't been taking very good care of themselves and are sicker than they need to be. So what ends up happening is somebody will not manage their blood sugar well or not manage their asthma well. They'll have an asthma attack. They'll be unconscious from low blood sugar. Someone will call 911. We'll come out and do some actions to help resuscitate them, to bring them back around, and transport them to the hospital where they'll get some care in the emergency department, maybe be admitted to the hospital, maybe not. and then get discharged to go back home. And one of the questions is, what is the level of self-care knowledge, self-care ability that people have in the community? Can they do things to take care of themselves? So a big part of what this series is going to focus on is what are things that people can do to manage various disease entities. What are some of the things that can be done easily to help prevent the development of disease? I'm basically trying to get people to stay out of ambulances, even though I'm in the ambulance and emergency medical business. I'm kind of have the intent here to decrease people's need to call 911, because it means decreased suffering in the community, saves healthcare dollars, and it's just good for us all the way around. So that's going to be the primary focus of what we're going to be talking about during the course of this series. We're going to do interviews with some of the people. One of the advantages of being in the Bay Area and part of American Medical Response here in Alameda County is that we have access to people who are doing some of the coolest cutting-edge innovation in grassroots, door-by-door, in the neighborhood, in the community, healthcare improvement of any place in the world. And we'll talk with some of those folks, talk about the innovations they're doing, the progressive things they're thinking about doing. We'll have information here that you can use for yourself to improve your own health, information that you can use to coach your friends and family members who may have certain diseases that would respond to a little bit of change in behavior, a change in action on a daily basis. We'll talk about some of the things that can be done to prevent disease and really learn from the experts and hopefully develop a conversation, which is one of the nice things about interactive media is you can leave messages and we can have a conversation about what are some of the innovations and things that you can do and other people can do around you in order to be able to make our health better all the way around. Thank you. I look forward to this series.